Hello, everyone. My name is Athena Phillips. I am the founder of Integrative Trauma Treatment Center and the Arenda Project, and I also am the course creator for the trauma coaching program that I'm going to be presenting on today. Unfortunately, we had some technical difficulties with the last recording, so I'm having to redo this without Lexi present. Lexi Sheehan is a certified Arenda trauma coach and a certified Reiki provider who is working with me with some of my clients and with some other clients in a coaching capacity at our clinic. But she's not going to be able to be here for this part of the presentation, so I will present on her part of the training. Unfortunately, I'm so sorry. But I'm just going to move through. It didn't take very long to do this training and to get through the content. So hopefully you find it helpful. And if you have questions, please feel free to reach out to the Arenda Project and we'll get back to you as soon as possible. You can do that through our website, which is listed on our YouTube channel, but just in case, it's info@thearendaproject.org. So trauma therapy and coaching working together, an adjunctive approach. I'm going to talk about what we've been doing at my clinic and how it's been going. So the learning objectives today will be to describe the 5 tenets or pillars of our coaching approach. I'm going to talk about what trauma coaching is, as well as describe the rationale for introducing trauma coaching in general. I'm going to talk a little bit about current research behind coaching, as well as discuss scope of practice for coaches and therapists, and describe how they can work together. We'll describe the outcomes of some of ITTC's coaching and therapy pilot that we've been working on for the past 6 months or so, which has been very exciting and rewarding. So hopefully that's of interest to you. I presume it is if you're watching. So let's start. Trauma coaching defined. Trauma coaching generally is focused on skills, enhancing performance. Coaching is behavioral focused. It is not insight-based. It's focused on personal growth and tends to be rooted in humanistic psychology, positive psychology, and post-traumatic growth theory specifically. This training is for post-traumatic growth or rooted in post-traumatic growth. As well as positive psychology and humanistic psychology. Coaching tends to be present and future-oriented, focuses on action and behavior, measures change, and is strategic. Not that therapy isn't strategic and doesn't measure change, but these are some specialties in the coaching arena. The 5 pillars or tenets of Arenda's trauma coaching program include the following. Growth after trauma. We assume that all people have the capacity to grow after trauma and that they will bring unique things to the table, regardless of whatever phase they are in their recovery process. Finding purpose is one of the outcomes that we hope to address and support our clients in working on, because sometimes that can get lost after trauma. Authenticity, self-agency, community, and connection are the other 3 pieces that we'll talk about more in a little bit more detail. So again, growth after trauma. My approach in the training that I created is rooted in the assumption that all people have capacity for post-traumatic growth, and that coaches and therapists can work together in facilitating making meaning and integrating trauma into a cohesive self-concept. So trauma happened, there's a me before and a me after, and who am I now once I've combined the way I knew myself to be at one time and the way I know myself to be now. There are examples of post-traumatic growth, 9/11, these large-scale events, Rwanda's genocide against the Tutsi, and the hero's journey, which I'll talk about in just a moment with one of the slide. But when we see people who have been exposed to an experience, either a collective experience or individual experience that changes their view of themselves, others, or the world in fundamental ways, it does create opportunity for growth. And that growth really is about, basically people have something unique to share when you experience trauma. And specifically what is unique is going to be reflective of a value set and also reflective of a certain kind of experience. So some people, for example, have experienced the loss of a child. That's a really painful, excruciating event that probably only other people who have experienced something similar can relate on the same level. And being able to give back to those who have shared your experience, or even just share your experience without giving back, is in and of itself growth and healing for people. And so again, these experiences that are rooted in trauma provide a special kind of information that can be shared with others who have something similar in their past. You may or may not be aware of Joseph Campbell's work, where he went, researched many cultures and looked for patterns in response to adversity. And these patterns, he found that these patterns play out across cultures very consistently, to the extent that we've included them in many of our cultural narratives, movies, books, etc. There's always a hero who's called to adventure. That adventure would be, well, sometimes it's healing from trauma. In this case, that's what we're referencing, that when we decide to address and confront our past, that is the adventure that we're being called for. But we need people to support us along the way, and that can come in the form of spiritual support. It can come in the form of mentors or helpers, such as therapists and coaches, but those people are fundamental and crucial to the healing process. And then moving into the abyss, which in this case is referencing confronting and addressing the trauma story and what happened. Once clients are in there, or people, I should say, are in that stage of their recovery, that begins to, it's the impetus for transformation, atonement, and return. And return is where we begin to integrate the pre and post trauma selves. Now, this is my interpretation of Hero with a Thousand Faces, which is Joseph Campbell's book on this. But you can see this pattern in a lot of our movies in the US. Some of them might include Back to the Future, where you have a hero and then there are supernatural aids, there are mentors and helpers available. Sometimes they're not obvious. It's not super obvious who those people are along the way, but people find them. And then there's a deep challenge, and then there's a return. Another one another really famous movie is Star Wars, it replicates this whole pattern, this archetypal pattern that occurs in cultures. So we are supporting our clients, regardless of whatever phase they're in this process, in working towards the return and integrating the pre and post trauma selves. But finding purpose following the return is a component of growth. And it comes out of the uniqueness of the traumatic experience. The survivor carries this unique knowledge and has the capacity to share it with others as an effort to then support them in their journey. Authenticity. Our true selves can become hidden behind our emotional defenses. And I always say that the vast majority of people are fundamentally likable. Sometimes our defenses are the things that can be challenging to interact with. Examples would include anger, narcissism, maybe inauthentic joy or happiness, emotional neediness, etc. Our true selves are really a hidden gem that are worth protecting and that our defenses are designed to protect. At the same time, they can interfere with our ability to interact safely and comfortably with others and with the world around us. So coaches can help clients reconnect with their authentic selves, as well as identify and work with their value set, which ultimately reflects who they are at a fundamental level. Self-agency is another tenet of my coaching program. Trauma is the opposite of self-agency. Helplessness is typically a key ingredient in a traumatic experience, and that can sometimes result in searching for a rescuer or a hero, maybe in our care providers or our relationships, and getting stuck in this I can't mindset. So coaches can help facilitate moving out of that mindset and recognizing that now is different from the trauma. This may also arise out, or a lack of self-agency, or perceiving self as having a lack of self-agency may arise out of grief from not having been helped, supported, or saved in traumatic histories when somebody should have been there for our clients. Coaches can acknowledge these origins while helping clients reconnect with their own strength, capacity, and we do encourage coaches to do with our clients, not for our clients, in order to support the growth of self-agency and awareness that it exists. And we do help our clients help ourselves. This is true for therapists and coaches, of course. Connection and community is something that's important to cultivate in working with a client who has experienced past trauma. Isolation can occur in response to emotional overwhelm, difficulty managing emotions, experiencing distrust in others, or feeling generally unsafe in any environment, even alone. But because of the distress that's associated with being out there in the world or being in relationship with others, many trauma survivors begin to isolate and disconnect from those around them, which then can perpetuate a sense of aloneness and activate other symptoms, truthfully. So trauma symptoms can, again, make it difficult to be in relation with others. Coaches help clients reconnect with others at the client's pacing. So there's a slow exposure to connecting with others within the community or within the world around our clients, but it needs to be tolerable. And coaches can help support that. Coaches recognize the importance of building relationships with clients as a way of maintaining success following the ending the coaching and or therapy relationship. We really want to have a support system in place when our clients end their work with us, and coaches can help our clients behaviorally begin to work towards those goals. So why trauma coaching? Well, the biggest reason is that there's a huge global disease burden in terms of PTSD, a lifetime prevalence of 18 to 36%. And the number of years connected to disability related to mental health conditions has increased up to 16% between 2005 and 2013. Now, this study is obviously pre-COVID, so I'm certain that those numbers have changed quite a bit. In 17 countries, only 20% of those who met criteria for a psychiatric condition received care for that condition, with low and middle income countries being disproportionately affected. Also, the heritability of PTSD, we need to recognize that as an impetus for urgency and moving forward quickly. So within our lifetime, there are not going to be enough mental health care providers with advanced degrees available to treat the number of people who need support. So coaching is an innovation and an answer to that problem. But by intervening now, we are also changing the trajectory of the future for future generations. And I do feel a sense, again, of urgency to do something sooner than later. Also being just aware of the fact that PTSD and chronic diseases, we're aware, based on the ACEs study done by Kaiser, that the more trauma somebody is exposed to in childhood, the greater risk they are for chronic health conditions in adulthood. And those conditions, such as heart disease, a lot of mental health conditions, diabetes, etc. Those diseases are very expensive to treat. So we can mitigate those costs and the amount of suffering incurred by people who have experienced trauma by addressing it now. And coaching and therapy together is one great way to do that. Just again, emphasizing the global gap in care in a look at 17 countries. Low and middle income countries carry the largest burden of the gap in care. And the World Health Organization estimates that over 1 million mental health workers are needed to meet the growing demand. And over half of the population at the same time will experience trauma in their lifetime, with an almost 8.8 lifetime PTSD prevalence on a global scale. So clearly there's a need out there that we need to fill. The World Health Organization has for some time now endorsed and is doing task shifting and task sharing, which is a means of filling this gap that I've been talking about. This is a way to fill those gaps in medical and mental health care all over the world. An example, again, in Rwanda, for example, there is an effort to support community health workers who are people who don't necessarily have advanced degrees, but do have training in a variety of areas that allow them to be a liaison between patients who need treatment and treatment providers, and to provide specialized education, meet all kinds of needs that treatment providers don't have the capacity to do, and treatment providers don't necessarily need to do either. And also other examples are peer supports. That has been something we've been doing for a long time in the United States and other parts of the world, and has been supported by research as an effective intervention. And lastly, other medical providers have support staff. Therapists are the only ones that don't. So there are certified nursing assistants, there are nursing assistants, there are dental assistants, there are physician assistants, there are a variety of types of support staff for other types of medical providers. And I do believe that therapists also need a little bit of extra support to be able to do their work and expand their capacity to do so with longevity. And expanding, the highly educated workforce to meet demand is not possible within our lifetime. It's going to take time to fill those gaps, and innovation is necessary with some urgency to provide support to people who are struggling in the here and now. Yes, so more therapy is not the answer, basically because we can't provide it, but innovation is. Another thing about therapy is that it's expensive, it's difficult to access, and we really need to find some ways to support people that are more accessible generally. Coaching and research, let's talk about why coaching might be a good avenue for bridging this gap. Here's a case study on coaching and dissociative identity disorder. DID is one of my specializations, and so I was very excited to find this case study that has been published on a client with DID, where the client clearly understood and benefited from unique roles of the therapist and coach. The client was able to utilize both in different ways and reported feeling holistically supported in their recovery process by having both types of supports available to them. Another study on borderline personality disorder, dialectical behavior therapy and coaching, generally lower attrition, greater reduction in symptoms, and higher overall satisfaction with treatment. In another study with eating disorders and coaching, 40% of those receiving coaching experienced a reduction in urges to engage in eating disorder behaviors. And no study to date has shown harm to those who have received coaching supports, and all but one have shown benefits. So, but this is a concern that comes up with some regularity, specifically from therapists, and I can see why it's legitimate. What is the scope of practice of a coach, and what's the difference between coaching and therapy? Well, therapists, we assess, we diagnose, and we provide a treatment plan. That's thing one. With trauma, we process that trauma utilizing various modalities that only therapists can get trained in, such as EMDR or DBT, for example. We work on the trauma story, and we are oriented to past, present, and future. Also, therapy is rooted in the medical model. Coaching is different. With therapy or with medicine, the first question we're basically asking is, what's wrong with you? With coaching, we're asking first what's right with you. And that's a nice way to balance out what we're doing. We're asking, what are your strengths? And how can I capitalize on those strengths? And that is complementary to identifying, symptomatology and other challenges that people come to therapy for. And so it's a nice, well-rounded approach to working with people with trauma. Coaches are focused on self-determination and self-generated goals. They are accountability specialists. They're great at measuring progress. And these are things that I emphasize in my training. I don't know if other coaching trainings emphasize the same things, but these are my orientations. Strengths-based and solution-focused. That's very common to actually most coaching problems. Coaches do not work with the trauma story, and in fact, often don't even know what it is. Coaching is rooted in positive psychology, humanistic psychology, and post-traumatic growth. And I basically conceptualize coaches as skills specialists, whereas therapists are different. They're treatment providers. So why should we work together? Well, first of all, coaching is hopefully less expensive, or trauma coaching is less expensive, can be less expensive than therapy. And if we provide adequate support through coaching alongside therapy, hopefully the overarching cost to the client will be less. And one of the ways that can look is by alternating, for example, therapy and coaching sessions. So overall, let's say somebody spends $150 on a therapy session. That therapy session, we only do 2 a month. And then we do 2 coaching sessions at less. Overarchingly, that's less cost to the client. And that should be something that is on our minds as a treatment provider. Overall, we want to be contributing to not only the mental health of our clients, but their financial health by being aware of how the cost of care affects their day-to-day life. We want to decrease the amount of time spent in therapy. And I believe that by offering additional support or different kinds of support that we can do that. We want to decrease the isolative nature of therapy for therapists, coaches, and clients alike. And by building a team around the client, we're doing that for all parties involved. Hopefully we improve outcomes by providing, for example, supportive bridge appointments when we're working through past trauma. This provides less pressure on the therapist to support clients during those difficult times, but then clients still have someone available to them to help because trauma processing is dysregulating and really hard work. Coaches help increase accountability and client engagement in the healing. That's part of the role of a coach, is to ask those questions. How's it going with these goals we're working on? And to really become a partner with the client in that process. Both therapist and coach work from a yes, you can perspective, hopefully, recognizing clients' strengths, helping clients recognize clients' strengths, and then capitalizing on those strengths to work towards treatment goals and coaching goals. And then, as I mentioned, there's increased support for both the therapist and the client, and hopefully the coach feels supported as well. So a little bit on our case presentations. First of all, to protect the privacy of our clients, we do not present on an actual client. We identify themes of those that we are working with, and we share those themes. Any demographic data, pronouns, or descriptions are used randomly and do not reflect an actual client or person, and we do not share any specifics of trauma stories. With that said, these are the themes of clients that Lexi and I are working together on, and that Lexi is working with at my clinic. Several of the clients have a diagnosis of dissociative identity disorder or some other form of dissociation. Many of them struggle with mood difficulties, including depression and anxiety. Bipolar 2 is very common in this population as well. Clients are presenting with substance abuse or dependence, disordered eating. Many of them struggle with chronic suicidal thoughts and self-harm. And also many struggle with their relationship to their bodies. Themes and goals for therapy: decreasing intrusive symptoms of trauma, such as nightmares, flashbacks, triggers, etc. Decreasing mood difficulties, improve emotion regulation or management skills. We want to decrease substance use, abuse, and or disordered eating behaviors, increase engagement with others and build community, and decrease symptoms of dissociation, such as amnesia, a fragmented sense of self, and self-puzzlement. So these are some of the themes common in goals for therapy that we're working with together. Themes in the client's history include early onset childhood and chronic sexual abuse, typically between the ages of 5 to 7 years. So we're working with very highly traumatized people. Neglect throughout childhood, various types of abuse, including physical, emotional, verbal, and sexual, often with multiple perpetrators throughout development. and occurs in the context of a lack of protection, a lack of acknowledgement of the abuse, and that can be combined with emotional incest or parentification and abuse by a caregiver. Our goals for coaching, or Lexi's goals for coaching, the themes have been to maintain meaningful connection with others. That's a common theme that comes up. And to support clients in really differentiating between safe and unsafe social circles, and supporting the search for enriching friendships and relationships and communities. We work on boundaries and assertive communication as a way to maintain safety, and also learn how to honor boundaries of others. Those are basics for healthy relationships, and sometimes our clients struggle with those things. So we want to be able to provide a non-judgmental and safe space where clients can have behavioral approaches and skills around those challenging topics. We want to be able to manage symptoms brought on by trauma. An example is a trigger management plan, that we recognize that trauma causes us to be activated. Our trauma can be activated in the present, and that can send us back into the past. So we want to have a plan for how to manage that when it arises. We want to be able to support our clients in understanding emotions and symptoms and using them to work towards healing. We want to have accountability for self-harm, substance use, and emotion management in order to, because those things need to be stabilized before we can even get into the trauma story. So coaches can really help with the accountability piece of that, so the therapist can then begin to work towards processing the past trauma, which is dysregulating and all of those things, as I mentioned before. And also, tending to healthcare can be very challenging for survivors. Putting ourselves in a vulnerable position is really difficult with past trauma in the rearview mirror. So many clients will avoid addressing health concerns because it's too scary to go to the doctor. And sometimes people don't notice that they need to go to the doctor because they're kind of detached from their bodies as a way to protect themselves. So coaches can help clients plan for healthcare appointments, help them follow through on healthcare appointments, and help them be in the driver's seat when they're preparing to go meet with their providers. Also, we want another theme that has come up is finding purpose and direction. Trauma can really dysregulate our sense of self and direction in our lives. So we want to help our clients sort of get back on track and explore images of who they are, what their core beliefs are, and how those can support them in their recovery process. And again, this is a coaching dimension, or an area where a coach can help support clients' work. Sorry, and again, this is one of the themes that these are all the themes, not all the themes, but some of the themes that have been showing up as goals for clients pursuing coaching at our clinic. We have been providing pre and post surveys so that we get some data on how it's going from the client's perspective. And so far, so good. It's pretty exciting. We issued the PTSD scale and saw improvements in half of the responses. This was over an 8-week period from my symptoms are impairing me quite a bit. That moved down to moderately. So we're not seeing perfection in 8 weeks, but I wouldn't have expected to. And from the pre-assessment, we've seen the biggest improvement around strong negative beliefs about self, other, and the world. Part of that is because probably being in relationship with someone outside of the therapy relationship is another opportunity to challenge those negative beliefs about self, other people, in the world. Coaching assessment. So we also provided assessment to see how the client experienced coaching in general and what their satisfaction was with it. And how their satisfaction with the coaching affected various dimensions of their life. So most notably, the themes were improvement in quality of life, relationships, and mental and spiritual well-being, with big substantial improvement in skills surrounding ability to address problems and communicate assertively. That is how it's going. I can say from a therapeutic perspective, it feels really good to have somebody supporting me, and somebody working alongside me with my clients. It's less lonely. I feel like my clients have more dynamic kind of support than what they've had in the past. And so I can see benefits both from a therapist perspective and from a coach and client perspective as well. So if you're interested in becoming a coach, obviously I provide a trauma coach training. It is available online. You can get the full certification online, 100% online, with most of it being asynchronous, so you learn on your own time and at your own pace. There is a self-study certificate of completion that you can do completely on your own. We also offer retreat style full certification hybrid, where you do some of it remotely and a large portion of it in person. Or you can just attend one of the retreat style trainings and receive a certificate of completion when you're finished. Our next one is Italy in September, Vietnam in April of 2024. And I do believe that having trauma coaches is a missing link in providing informed supports to survivors and really expanding access to care. So with that said, I thank you for your interest, and I hope to see you soon. Feel free to reach out if you have questions. Thank you.